Alright, so today we're going to do a demonstration of cupping. It's a use of a glass cup, like this. You see, it's tempered glass so that if heat goes inside of it, it doesn't shatter or crack on a patient. We wouldn't want that. And we use a alcohol doused cotton ball, which I'm going to do right now. And we douse that with alcohol and set it alight so that we can create a vacuum inside of the cup to apply to the patient's body. Stick that in there, douse it, make sure it's not dripping. So the reason for doing cupping is to remove stasis or stagnation within the body. This particular patient has a lot of heat, so you'll probably see quite a lot of Sha, or the petechia, which occurs on the body. You'll see for yourself. So we set it alight, and this is referred to as fire cupping. And you place the cup over the fire and place it on the body, okay? Okay. So you see that suction that has occurred. Now that was just flash cupping. Well, actually I'll demonstrate flash cupping first. Let's do that. Flash cupping is where you put it on the body and you pull it right back off. And this is just to release any toxins that are within the body. Toxins and stagnation are the main things that we address with cupping. It also improves the immune system when you go do moving cupping up and down this due meridian, which is along the spine. And then there's moving cupping, but before I do that, I'm going to put some oil on the patient's skin. And this is just regular baby oil. You want to evenly cover the skin so as not to cause them any pain as you're moving the cups up and down the back. There is some discomfort with moving cupping, but the results are just as pleasing. So most patients find it worthwhile to do. I'm going to redouse this alcohol now. Redouse it in alcohol, rather. And you can use either 70% alcohol or 90% for practitioners that are learning to do this. 90% is a lot easier to do. I'm using 70% because I've been doing this for a while and I'm fine doing it like that. And this is a medium-sized cup. And you look at the suction, and it's pretty strong. Do you feel it, Jeremy? Mm-hmm. And now, as you see, the redness is occurring on the body, and the petechia is showing. I don't know if we can get a close-up of that. And you just move up and down. And this is a UB meridian that we're going up and down. And it clears heat in the body. You okay? For a person that doesn't have any heat, nothing would show up when you do this. And I'll demonstrate that after this. Just go up and down. Right here, the vacuum is released, and so it's usually where it pops off, as you can see. Now I'm just going to go up and down the dew meridian. It's not strong enough, so I'll reapply that. And the good thing with fire cupping is that you control the suction. And it takes practice, but over time you learn how to control the amount of suction that you apply. And this brings the toxins to the surface. When you see the Shah, the petechia, the redness, it's just brought up all the toxins that are in his body. And it brings up any stagnation, any blood stasis that is causing any pain. So the common method used for people with respiratory disorders, for asthma, tuberculosis, pulmonary disease in general. Insomnia can be released by doing cupping. Different modalities are used dependent on your constitution. So a person with more heat causing the insomnia or causing the insomnia or the headaches, for example, I would use cupping. A person who's more deficient would probably get more moxa and more needles. And that's it. That's a demonstration for cupping.